Hey everyone, and welcome back to the channel. Have you ever dreamed of a real-life fountain of youth? You know, a pill that could not only help you manage your health, but potentially extend your lifespan, keep you feeling younger, and even protect you from some of the most feared diseases of our time? Well, what if I told you that such a compound might already exist, right under our noses? Today, we're diving deep into a medication that's been around for decades, primarily known for treating type 2 diabetes. But increasingly, scientists are calling it much more than just a diabetes drug. We're talking about metformin. So what exactly is metformin? At its core, metformin is an oral medication that belongs to a class of drugs called biguanides. It's been a cornerstone in the treatment of type 2 diabetes since the late 1990s. Think of it this way. In type 2 diabetes, your body either doesn't produce enough insulin or it doesn't use the insulin it produces effectively, a condition known as insulin resistance. Insulin is like a key that unlocks your cells to let glucose or sugar in for energy. Metformin works in a few key ways. First, it reduces the amount of glucose your liver makes. Your liver is constantly producing sugar, even when you're not eating, and metformin helps put a brake on that. Second, it improves your body's sensitivity to insulin. This means your cells become better at taking up glucose from your blood, lowering blood sugar levels. And third, it slightly decreases the absorption of glucose from the foods you eat. The result? Better blood sugar control, which is vital for preventing the serious complications of diabetes like nerve damage, kidney disease, and vision loss. But here's where metformin gets truly exciting and why it's earning the nickname, the new fountain of youth. Beyond its primary role in diabetes, a growing body of research is suggesting incredible benefits in other areas. Let's break down some of these astonishing potentials. First, weight management. Unlike many other diabetes medications that can cause weight gain, metformin is often associated with modest weight loss, or at least weight stability. This is a huge bonus, especially since obesity is a major risk factor for type 2 diabetes and many other chronic diseases. Next, polycystic ovary syndrome, or PCOS. For women with PCOS, a hormonal disorder that often involves insulin resistance, metformin is frequently prescribed off-label. It helps improve insulin sensitivity, which can lead to more regular periods, improved ovulation, and even help with fertility. Then, there's cardiovascular health. This is a big one. Heart disease remains the leading cause of death globally. Some studies indicate that metformin may have direct benefits for cardiovascular health, potentially reducing the risk of heart attacks and strokes in people with diabetes, independent of its blood sugar lowering effects. Researchers are still actively exploring the mechanisms behind this. And finally, cancer prevention and treatment. This is perhaps one of the most intriguing areas. Emerging evidence suggests metformin might have anti-cancer properties. Studies have shown potential links to reduced incidence of certain cancers like colorectal, breast, and pancreatic cancer, and even improved outcomes for cancer patients already undergoing treatment. It's thought to work by influencing cellular energy pathways that cancer cells rely on. Now let's talk about the fountain of youth directly. The idea that metformin could slow down aging isn't science fiction anymore. It's a serious area of scientific inquiry. The leading theory revolves around how metformin impacts our cellular metabolism, specifically a pathway called AMPK, or AMP-activated protein kinase. AMPK is often called the master regulator of metabolism. When activated, it essentially tells your cells to switch from energy-storing mode to energy-producing and repair mode. This activation mimics some of the benefits we see from calorie restriction, a known anti-aging strategy without the need for strict dieting. By activating AMPK, metformin can improve mitochondrial function, and mitochondria are the powerhouses of our cells. It can reduce inflammation, which is a key driver of aging and disease. Plus, it promotes cellular autophagy, a process where cells clean out damaged components, essentially recycling them to stay healthy. There's even a landmark clinical trial in the works called TAME, which stands for Targeting Aging with Metformin, aiming to specifically study metformin's effects on age-related diseases and longevity in humans. If successful, this could be groundbreaking. Okay, so metformin sounds amazing, right? Like almost a miracle pill, but it's crucial to remember that no medication is without risks. It's definitely not a magical candy, and it's essential to really understand the potential downsides before getting too excited. The most common side effects are usually pretty mild and often get better over time, especially as your body adjusts. For example, gastrointestinal issues like diarrhea, nausea, vomiting, stomach pain, gas, and indigestion are very common, especially when you first start taking it or if your dose goes up too quickly. Taking it with food can actually help a lot. Some people even report a strange metallic taste in their mouth. Now, let's talk about the more serious but thankfully less common risks. The most serious concern is lactic acidosis. This is rare, but it's a potentially life-threatening buildup of lactic acid in the blood. The risk goes up a lot if you have severe kidney disease, liver disease, a severe infection, congestive heart failure, or if you use alcohol heavily. Symptoms of lactic acidosis include things like extreme tiredness, weakness, muscle pain, stomach pain, nausea, vomiting, decreased appetite, deep and rapid breathing, dizziness, and an irregular heartbeat. If you experience any of these, you should seek emergency medical attention right away. Another thing to watch for is vitamin B12 deficiency. Long-term metformin use, especially over several years, can lead to this deficiency, which might cause nerve damage, numbness, or tingling in your hands and feet, muscle weakness, memory problems, and even a sore tongue. Your doctor might recommend regular B12 level checks if you're on metformin long-term. And while metformin alone rarely causes low blood sugar or hypoglycemia, the risk does go up if you're also taking other diabetes medications like insulin or sulfonylureas. Because of these risks, metformin just isn't suitable for everyone. It's absolutely crucial to have an honest and detailed conversation with your doctor about your complete medical history. You should not take metformin if you have severe kidney disease, liver disease, severe heart failure or a recent heart attack, a severe infection, severe dehydration from things like vomiting, diarrhea, or fever, or if you have heavy alcohol consumption or alcoholism. And you may need to temporarily stop metformin before certain surgeries or imaging tests that involve injected iodine dye. Always, always, always inform your doctor about all your medical conditions and every single medication, supplement, or herbal remedy you are taking. Metformin can also interact with other medications, potentially affecting its effectiveness or increasing side effects. Some common interactions include other diabetes medications, which, as mentioned, can increase the risk of hypoglycemia. Diuretics or water pills can sometimes make metformin less effective. Corticosteroids can also counteract metformin's blood sugar lowering effects. There are also certain medications that increase metformin levels in the body, and this can raise the risk of lactic acidosis. Examples include cimetidine, ranolazine, and some anti-HIV drugs. Alcohol, in particular, significantly increases the risk of lactic acidosis and can worsen B12 absorption. So this is why your doctor really needs a complete picture of your health and all the medications you're taking. So, after hearing all this, you might be thinking, should I be taking metformin for anti-aging, even if I don't have diabetes? Here's the most important takeaway. Metformin is a prescription medication. It's not something you should ever self-prescribe or obtain without medical supervision. While the research into its anti-aging benefits is incredibly promising, and many longevity experts are taking it off-label, it's currently only FDA approved for type 2 diabetes. If you're considering it for longevity or any other off-label use, you absolutely must consult with a knowledgeable healthcare provider, preferably one who is up to date on the latest research in longevity and metabolic health. You should also undergo a thorough medical evaluation to assess your kidney function, liver function, and overall health to make sure it's safe for you. And it's important to discuss the potential benefits against the known risks for your specific situation. Plus, consider lifestyle changes first. Diet, exercise, and sleep are still the absolute foundational pillars of health and longevity. Metformin is not a magic bullet that negates an unhealthy lifestyle. The story of metformin and its potential as a fountain of youth is still being written. We're in an exciting era of medicine where we're beginning to understand the intricate processes of aging and how we might intervene. The TAME trial, which I mentioned earlier, holds incredible promise. If it shows significant results in delaying age-related diseases, it could pave the way for metformin to be used much more widely for longevity. Imagine a future where a simple, affordable medication could help keep us healthier for longer, reducing the burden of chronic diseases like heart disease, cancer, and neurodegenerative conditions. That's the exciting potential metformin represents. So, while metformin isn't a definitive fountain of youth just yet, it's certainly a compelling candidate for future research and potentially widespread use in healthy aging. It's a testament to how much we're learning about the human body and how existing medications can have unexpected, powerful benefits. What are your thoughts on metformin? Have you or someone you know taken it? Share your experiences and questions in the comments below. We love hearing from you. If you found this video informative and thought-provoking, please hit that like button. Subscribe to our channel for more deep dives into health and longevity. And don't forget to ring that notification bell so you don't miss our next video. As always, thank you so much for watching. Stay curious, stay informed, and most importantly, stay healthy. We'll see you in the next one.